one of the things that's beautiful about life is this idea that kind of you alluded to, which is, to experience the unexperienced, right? And to really like discover what we're capable of in the world. And so, when the opportunities arise to do something really great that actually helps people, it's pretty darn hard to turn it down, no matter how much work it is.
Hello, my friend, and welcome to Something for Everybody. My name is Aaron Mashbitz. Dr. Dave, welcome to the show.
Thanks so much for having me, Aaron. It's a pleasure to be here with you.
Absolutely. My first and most important question is, Dr. Dave, how are you doing? Like, actually, how are you doing?
Good. A little tired because I'm recovering from a cold and I run a startup with my wife. So, we're working all the time. Tired, but good. I mean, there's a lot of exciting stuff happening. So keeps me going. And Apollo gives me a little energy to stick through,
That's true. That's true. Kate, I was going to ask you a bunch of different questions, but whatever you just said popped this into my head. So can you talk about the non-sexy side of being an entrepreneur? Because I feel like everything on social media is like, quit your job. It'll be awesome. Everything will be great. You'll, all this stuff. And then like you actually do it. And then like myself and you, like in the trenches, trying to find time to poop or pee or, even spend time with your spouse, even though you might work with them. It's totally different than getting quality time. So anyways, just thoughts on that.
Yeah, that's a great question. I think I can sum it up in this way. So I'm a psychiatrist and a neuroscientist, and I went through to be those things. I went through a lot of years of school and training outside of school in the hospital. That was grueling training, like 24-hour shifts and just, working and doing and studying all the time. And that was 4 years after college, usually working and doing research in the lab during the summers. And then 4 years after college doing medical school. And then 4 years after that doing like PhD in neuroscience. And then 4 years after that doing residency training in psychiatry. So when you think about that amount of work, that's like 12 years of additional grueling training that in addition to college. And that was really hard. But we have this joke in medical school. And the joke is, what do you call the person who comes in last in their medical school class?
You call him a doctor.
Exactly. And so there's a certain amount of certainty in the academic program of training whereby if you meet a certain, and I didn't realize this at the time, of course, this is like really upon looking back after having become an entrepreneur and realizing the differences. But when you go through that much training, what you don't realize while you're in it, because it doesn't seem like there's any certainty, is there's actually a lot of certainty, because if you just hit a certain standard of good enough, then you can get through, and the school wants you to graduate because it looks better for them, right? So there's an incentive to actually nudge you along to the path to the end goal of becoming a practicing physician who's providing care to the community. And so the problem is when you graduate from all of that grueling work, many of us think we can do anything because we've just subjected ourselves to some of the most intense training that you can do, and so naturally I discovered this technology in the lab during my research, and we decide, if this is just going to sit on a shelf if we don't do anything with it, and the results are this good with our study subjects, we should take this into a company and start a company and pull this out of university and do the thing. If I went to medical school and did all this stuff, I could do this. And what I realized after having done it for about 2 years, now we started the company in 2018. So now or 2017. So now it's 27 years in. About 2 years in, I realized that it's not necessarily about the amount of work. It's often more about the certainty that you have. And in entrepreneurship, there's this very interesting thing where no matter what you're doing or how many of the boxes that you check off that you think are like the boxes that everybody says, do this, if you do these things, you're going to have a successful business. And you can check off all those boxes and then some. And something can happen in the world that just makes all of that not matter anymore, all at once, right? Like the pandemic for many businesses, like iOS 14 for many businesses, right? Like many businesses, people don't know this, that like the introduction of iOS 14 changed the entire targeting structure for ad marketing, and tons of small businesses closed their doors because of that shift. And because they lost their ability to sell and target their customers without paying an exorbitant fee. So, it's just like that uncertainty piece is what stops people from sleeping at night. It's what messes up your appetite. It's what makes you, constantly stressed, because you don't know what is going to happen. You can do everything you can and you can still lose control of the ship. And so it just gave me a tremendous amount of respect for entrepreneurship and founders, and like, the kinds of challenges we take on, which are the real deal. It's like as much work as medical school, but it also comes with the uncertainty.
Yeah. Yeah, that's why I think like loving what you do is the competitive advantage, because
Absolutely.
like here's just some of the feelings I have every day being an entrepreneur. One day I'm like, oh fuck yeah, I'm gonna crush today. Other day I'm like, holy shit, I'm talking to no one. No one's listening to me. Oh my God, I have so much work to do. Oh my God, I could do more. Oh my God, I could do less. Why am I doing this? Holy shit, this is my life. Like, and it feels like it happens, all at once. And so, I mean, especially feel like with a podcast, right? Because you have a podcast, we're 240 episodes in here, and probably the first 200, nobody listened to it, right? And so it's like I love doing it regardless, because this conversation is beneficial for me if nobody listens. And so then people start to listen, and other factors come into play about sponsors and things like that. But whatever, that's unimportant. But I think it's important. Someone who went through something really hard as medical school now thinks that entrepreneurship is maybe equally as hard. So I think people should realize that when they venture out. But like, if you feel that thing in your gut that's telling you like, hey dude, this is your thing. And like the point you said was so important. Like if no one else is doing it, then that's why you're supposed to do it. And that's super, super, super important. So yeah, man. Awesome.
Yeah, it's thank you. And it's yeah, I mean it's a real it's an arduous path, and not all businesses are as hard as others. What we took on building a wearable hardware and software technology was a much harder beast to tame than starting like a direct, a lot of direct to consumer like supplement products and things like that, which are a lot easier. But I think that there's a lot of things that you don't necessarily consider when you're starting out, that you just don't know, right? One of the things that's beautiful about life is this idea that kind of you alluded to, which is to experience the unexperienced, right? And to really like discover what we're capable of in the world. And so, when the opportunities arise to do something really great that actually helps people, it's pretty darn hard to turn it down, no matter how much work it is.
That's true. That's true. Yeah. What did your sort of your knowledge, your research on stress and handling that uncertainty help you on your path to creating this, to having the startup?
I so I It's a good question. So I think having the intuitive feelings and understanding of anxiety and uncertainty in myself helped to shape my experiences as a clinician, and the way that we actually develop the product. I think that we often don't think of uncertainty as something that is highly triggering for us, but our brains are interpret uncertainty the way we interpret general threat, like survival threat. And there's by default, because the amygdala, that fear center of our brains, is looking for things that were potentially dangerous to us. And if there's something uncertain or new around you, we basically almost always interpret it as threatening, at least just for a millisecond before we realize that it's not threatening and safe, and we can, maybe get to know it and be vulnerable around this new experience or person or thing. And so that is really important, because when we get stressed out, when we're overwhelmed and we have lots of stuff going on in our lives and we're really busy, that's, that starts to override the uncertainty signaling that says, if I'm already overwhelmed, if I'm already stressed out, I'm already like amped up in my fight or flight response, then we start to increase the amount of fear that comes from uncertainty. And it's kind of a vicious cycle where, we start to actually build up this chronic stress response in our bodies, where our bodies interpret ourselves as being under threat all the time. Because there's so much uncertainty in the world, right? There's actually way more uncertainty than there is certainty. However, humans have this incredible ability to pay attention to whatever it is that we want to pay attention to at any time. And so we can tune into things we are certain of at any time, and that starts to shift the balance toward recovery again and towards safety, and which is reflected in the nervous system as fight or flight, sympathetic nervous system activity shifting towards parasympathetic rest and recovery, vagal nervous system activity, which decreases heart rate and decreases breath rate and blood pressure and slows down our thoughts and helps us feel calmer and more at ease. And so, I think part of, it's a kind of a natural part of being human to have these kinds of uncertain experiences and to have anxiety from uncertainty. But also being a therapist and being a psychiatrist and somebody who helps take people through the healing process of working through these challenging thought patterns, is really helpful to help me understand my own, and then also to create a product that actually helped to balance the nervous system through the body and solve some of those problems for people.
Yeah. What is your research in neuroscience say about the mind-body connection? Because there's a lot of discussion about that, and a lot of people have this. I think for a long time there's been the idea that they're two separate beings, but obviously that's untrue. As it's getting very much more clear and in prominent media that they're interconnected, and we have to treat them as such. But your input or expertise on that sort of subject.
Yeah, I mean, I love to talk about this. I think this is one of the most common misconceptions in science, is that the mind and the body are not separate. They are connected. They are intimately and irreversibly connected. When we are mentally unwell and we don't do anything about it, we can feel physically unwell as a result. And when we're physically unwell and don't do anything about it, we can feel mentally unwell as a result. So they're completely intertwined. And the part of the reason why there's confusion around this in particular is because of René Descartes in the 1800s, who's a famous philosopher of science, who sat in a room by himself, naked by candlelight for I think it was 28 hours or something like that, and maybe longer. And he came up with this idea of how to do research on oneself or on people, how to do clinical research in a way, and scientific exploration of life and of consciousness. And so he was one of the founders of what we call scientific theory and scientific research theory, and which is basically the idea that there has to be an observer, right? To do a scientific experiment of any kind, there has to be someone watching what's happening and measuring it. And so if the mind and the body are separate for the purposes of science, then the mind can observe the body, right? Mm-hmm. And the body as part of the experiment. And so I think it was interpreted in lots of different ways, particularly that the mind and the body are actually separate. But I think it's more about understanding what he was talking about from the scientific research perspective of the way we conduct scientific research is we have to have an observer that's looking at what's happening and measuring it and tracking it. And then that allows us to understand what's happening over time and how things work.
Why do you think it's taken so long for us to sort of, make this connection that the mind and body are one, and things you do for your mind affect your body, and they're interconnected, and things like that?
I don't know. I mean, old ideas die hard, right? Mm. It's hard. There's been so many other examples of this in science over time, like the guy who just Galileo, right? Or the guy who was burned at the stake for discovering that the earth revolves around the sun. And that the Earth is round, and then the fellow who discovered hand washing was institutionalized for his discovery because it was believed at the time that it was impossible for a man's hands, because all doctors were men at the time, it was impossible for a man's hands to communicate disease.
Whoa.
Isn't that wild?
Yeah, I've never heard that before.
Yeah. So in the 1890s, there was a very famous, I think it was Swiss or Austrian physician who, and at that time, again, all the doctors were men, and there was no germ theory. So nobody understood that you could communicate disease with germs. So people didn't really know how people got sick. And the doctors were doing autopsies and then delivering babies. And the infant mortality rate and the maternal mortality rate from infections, because they weren't washing their hands between doing autopsies and then delivering babies, was like over 50%.
Whoa. Right.
So you had like a 1 in 2 chance of survival, or a 1 in 2 chance of death of either mother or baby with every childbirth. That's ridiculous. Right.
Yeah.
And so this very famous doctor, whose name will come to me, did this experiment and just washed his hands between the autopsies and the baby deliveries, just wash his hands in between. And he reduced infant maternal mortality rate by like 90%.
Yeah.
And he presented this at the medical meeting, and they laughed at him. And then because there was no way that it was possible for a man's hands to communicate disease. The man's hands were thought to be infallible by science. Think about that, right?
Wow.
So you've come a long way.
Yeah. Oh man, that's a super interesting story. Holy cow. Well, I'm glad that that washing our hands has stuck around till this day, even though I go to the bathroom and there's a ton of dudes who go to the bathroom and they come out and they don't wash their hands, and it's usually at the gym. And then I follow them around at the gym and I'm like, if I'm going to use that piece of equipment, I'm going to spray it down because you have pee all over your hands. So,
Yep.
They're usually the thing they probably come back with is that I peed with no hands. And that's also gross because you probably have it on your fucking shoelace or something. But anyways.
I just remembered it was Dr. Ignaz Semmelweis.
Oh, that's a cool name too. Wow. All right. That's really cool. Well, thanks for sharing that.
Yeah. I mean, it's a sad legacy for science, to be honest, right? Like, yeah, it's a good story to learn from, but it's a sad legacy for science and medicine that, critical thinking was so far behind back then. And this was 1890s, right? And then there's a lot of time that's passed between then and now. And, we're still in denial about certain things, like, the mind and the body being connected, and that being part of like full on Western medical practice, and the way that, breathing can be used as a therapy to treat so many mental illnesses. And there's so many other things that we're behind on. A lot of Eastern and tribal techniques and research into those are very behind too.
Yeah. Yes. Speaking of that, what do you think we're still currently getting wrong about treating or dealing with our mental health?
I mean, the biggest problem with the way that we currently treat mental illness in the Western medical model is that it's entirely focused on symptom management and not addressing the core root of the issue. So if it's not to say that I think if you look across the board at clinical research studies and all of the data that's been compiled by the National Institutes of Mental Health, the NIMH, it is fairly clear. And I think it's even more clear if you include Eastern and tribal techniques and their what their medicine disciplines teach, it's fairly clear that trauma is at the root of most mental illness, unresolved, unprocessed traumatic events of some kind. And trauma being defined as one or multiple intense, meaningful events that were interpreted as threatening, for which we did not have support after. So that if we understand that is at the root of mental illness, then what is the antidote to trauma? Because trauma is a very well characterized response. It's been studied in humans and animals for 100 years, and we know that it's a trained fear response, right? And so if trauma is a trained fear response, then what's the opposite of fear? Safety. What's the opposite? If fear comes from uncertainty, what's the opposite of uncertainty? It's certainty, right? And so you start to control versus feeling out of control. And that you start to see these connections between how trauma, unprocessed traumatic events can lead to like depression, PTSD symptoms, anxiety. And when we actually do therapy with our patients, we're actually treating these people and we talk to them about, all of the stuff they're going through. Almost every single person, I can't remember a single patient my entire career, except a few people who were schizophrenic and couldn't really, they weren't in a state to be able to talk about their past, lucidly in a way that we could understand. But I don't remember a single patient that I've had across all diagnoses that did not have some identifiable significant traumatic event in their history. And so when you start to look at that and unpack that with people, then you actually start to get at the root of what's causing all the symptoms they're having. And the medications, which can be helpful for stabilizing somebody, are very helpful, but they are not getting at the root. They are just stabilizing people. And when you take the stabilizer away, people tend to get sick again if they haven't gotten to the root of what's going on. And so that's where psychedelic-assisted therapy and Apollo and more modern tools are becoming really interesting, because they help us to get to the root more quickly and help people get to the root on their own more quickly, which helps them solve the problems that they're having long term.
Yeah, like the first answer cannot be medication. Like, at least I think in personal experience. Now, to share a bit about my story, like I lost my sister to suicide in 2018, and her journey with medication was a very interesting one. But she had bipolar disorder, severe depression. At the end of her life, she was getting schizophrenic. So there was a lot going on, and medication had a lot to do with extending her life. Like it really. So I believe in that fact. But like the 2-3 years where she was on like different ones where she was like had no emotions at all, where she was like a zombie, and like there's just things that happen and you have to sort of create the right cocktail. But the first thing wasn't to throw her all those pills. It was to have a discussion about what happened when she was in college and get her with a psychiatrist and a therapist and talk through these things, and then make sure that she was on the right, and then giving her the right information, knowing, and giving our parents the right information, saying it's going to be a while before we figure out what's right for her. So this might be a test run here, not just having someone come in 10 minutes later, they have a description or prescription bottle and then they're out the door. And so rather we could be prescribing an eating routine, a sleeping routine, a thinking routine, a movement routine. You can write those prescriptions as a doctor. Instead of taking your pill every day, you have to move for 15 minutes today. Have to. Like there's no other option. And then we start there, and then maybe there's a downstream effect from that. And if you're still feeling like all of this stuff, then let's go to option B, C, all of these things down the line, so that you can still live a meaningful, joyous life. And as did my sister. She graduated college, she became an engineer. So sadly she lost her battle, but like there was still joy and love in there in the midst of her illness. And I think that's important to know.
Yeah, absolutely. And I'm so sorry to hear about your loss. And this is such a challenging issue to deal with. But you're absolutely right that having actually talking it out and empowering an individual to understand what's going on, and these different techniques of movement and thinking and how to interpret our feelings and different ways to help us or help ourselves feel better, which there are many and most are free, which is actually really great. And that we just need to be taught, in an ideal world, we would all teach our children when they were very young how to start doing these breathing techniques and basic meditation and mindful techniques little by little, because every little bit makes a difference. And the more we teach our kids, starting when they're young, and the easier it is for them to do it automatically when they're older, because they just start to you know, learn learn the stuff that really matters, that helps them self-regulate and become resilient and adaptable.
Yeah. I mean, I see that with kids in sports because I coach a 9-year-old baseball team. They're so cute. They're so little. They got so much energy. But like just teaching them that right before they step into the batter's box, if they take a big deep breath, they're much more calm and relaxed. If they take a bad swing, they look at mom and dad in the stands, they feel safe, then they take a big deep breath. Like just that one thing can change the whole trajectory of their life. Now, it's super important. And so like I can see the benefit of that. And now you introduce that in schools or in PE class or in all sports programs or whatever the case may be. The downstream effects are hugely powerful. Then someone gets into a tougher situation when they're in high school or college, or they get rejected from their job, or there's a heartbreak. At least they have a set of skills to fall back on. They're not learning something brand new, like, trying to walk when they're 18 years old, right? They have a little bit going for them, which I think is important.
Yeah, absolutely. And I wish somebody had taught me that when I was playing Little League baseball. That would have
Me
made
too. Yeah.
yeah, struck out so much.
Yeah, I wouldn't have thrown my helmet against the fence so many times, probably. But at least we're passing on the knowledge that we wish we had then now. So I think that's important. But back to thinking about trauma. Do you think some people ignore their trauma because they don't think they've reached a certain level of suck? Like they feel like their level has to be this much for them to tell someone or for it to matter, because like, yeah, someone has it worse, or that other person lost their leg, or mine's like, so I'm just not going to tell anyone. Do you think that has a lot to do with it?
I think it has something to do with it. We live in a suck it up society in large part, and there's a lot of stigma around talking about difficult things that have happened to you, and your feelings. A lot of us are taught when we're very young in different one way or another that expressing emotions, especially negative emotions, is not acceptable, right? And so it's hard because it makes other people sad around us, or it makes other people upset around us, or whatever. And so that part of culture and all the combinations of different things that we learn over the years about when and if it's okay to express an emotion or a feeling to somebody without being judged is very impactful on why we don't process trauma right after. But I think the biggest thing is that there's often not, in the same vein, there's just often not support for people after. And if people are given support after a challenging event, and meaning somebody's had some really bad shit that happened to them, and then they come to you and they tell you about it right after, there is still, believe it or not, an opportunity, an actually critically important opportunity, to make sure that person feels held and supported and seen and not judged in that moment, because you're the first person that they've told, right? And they are really telling you because they are looking for that support and that non-judgment and that acceptance, and just for somebody to hear them out without being judged, because it's often humiliating and embarrassing and vulnerable to talk about that stuff at all. And how do most people respond? What was wrong with you that you let that shit happen to you?
Mm-hmm.
Right?
Mm-hmm. It's not that bad, whatever the case may be. Yeah.
Right.
Yeah.
And it's not, and all of those things, even it's not that bad, which is like the least, amongst the least bad of the responses that we commonly have. And,
right.
and I've done this. So this is like a human thing that we all sometimes don't respond in the right way to people when they're trying to communicate with us, right? It's very common in marriage, especially. But I think there's it's this, when something bad has happened to somebody there's an opportunity, and the main point is an opportunity to soften the blow of that thing, as bad as it could have been, by just providing that person that non-judgmental support and just saying, hey, wow, that must have been really hard for you.
Yeah.
Right? That must have been really hard for you. I'm so sorry that happened to you. Or I can't believe that that happened. I am, what, do you want to talk about it? Right? Like, is there anything I can do to help you? Right? And just being there and being present and not trying to fix it, or not trying to tell the person that it was their fault, which is the worst case. There was that implying that it was their fault, that they put themselves at risk of that terrible or traumatic event happening to them, which could even be like getting bullied in school. It could be anything.
Right.
It could be being ignored by your parents or by somebody else.
Yeah.
So that support opportunity is critical.
Yeah, there's this nonprofit called Active Minds. I'm not sure if you've heard of them, but they have this 3-step approach, this acronym that basically like says exactly what you're talking about here. And it's called VAR, and it's validate, appreciate, and refer. And if you think about those 3 steps, that's exactly what you explained. Validate their feelings, like just say, hey, wow, I'm sorry that happened to you. You appreciate them for sharing, because everyone who's listening to this knows that it's really fucking hard to be vulnerable. So you just appreciate that strength, that courage. And then refer is yeah. And then the last one, refer, is just like what you talked about. It could be anything. You're basically asking them a question at that point, like, what do you do for self-care? How can I help you with this? Or should we go talk to someone? Depends on where you are. If you're at campus, you're at home, whatever the case may be. But man, like if you think about this right now, like just being seen in that, like as a real person who could potentially go through something hard, and someone sees you in that and they're like, oh yeah, like that is really hard to go through. Like, shoot. Okay, man, I'm sorry that it's been like really hard for you to get out of bed for the last couple of days. Like, what's been going on? Oh shoot, like your mom is sick. Oh, okay. Like, is there anything I could do to help? Do you want to talk about it? Do you want to just sit here? Do you want to play a board game tonight? Like just these simple things that we can do as human beings. And again, like you said, we're not always going to say the right thing, and that's cool. We make mistakes, but if there's a level of honesty and integrity about it, then it's always going to come off better than like, dude, fucking put some dirt on that shit. Let's go. And like,
yeah.
So anyways, go ahead.
Oh, well, no, I mean, you're exactly right. And I was just going to add that I think part of the reason why sometimes we get caught in the trap of not responding the right way, which when you put it, when you put like an acronym to it, it's pretty darn simple, right? Like if somebody comes to you having a hard time, like validate, appreciate, refer, or reflect back to them, right? And have a conversation, that's pretty simple. Like we can all do that thing, right?
Mm-hmm.
Like just by nature of being human, we can all do that for each other for free. Like you don't need to pay somebody like me to get that service. I'm expensive. Like we can do this for each other for free. And so, when you think about that, it's just, why don't we? Right. And it's because a lot of the time, what ends up happening is we accidentally take it personally when somebody comes to us with shit that they're carrying. And that is one of the most common traps that we fall into when somebody's talking to us in a way where they sound upset, or they look upset, or they obviously feel upset, or they're yelling, or whatever it is. It's always because of something that's going on with them. It doesn't ever mean anything about us. Does that make sense?
Yeah, that's what you mean by the personally part. I was going to ask you to say more, but I got it now. Yeah. Okay.
Yeah, and like this is part of the 4 agreements. It's like indigenous, tribal knowledge, right? Is like, don't take anything personally. Don't make expectations. Always do your best, and always be impeccable with your word, which are like really another like simple paradigm for how to think about like retraining the brain to function fully. But this is, the taking it personally thing is something that we all need to be aware of, because that oftentimes the person just wants us to be present with them, and it's not about us. So if we just remind ourselves, and I think this is something that I've learned over the years, and it takes practice, but once you understand what I'm telling you, like it becomes a lot easier, which just remind yourself before you're about to go into a conversation with somebody who might be upset in any way, is that just tell yourself, like, this isn't about me. I'm just coming in to be here for this person. I'm just coming in to hold space for this person, right? I'm just going in to be present for this person. This is not about me. It's not about me. And just remind yourself of that. And in doing so, like I used to do this sometimes, like in my early days of training, like before I'd walk in to see what I knew was going to be an extremely challenging patient encounter, because they were going to be yelling or upset, or, really like sometimes crazy shit happens and you
Right.
can't predict it. And so, you know, that these little techniques really, really help to improve our awareness and our sensibilities and our ability to be present with each other in those situations. And it's healing.
Yeah, and it's healing. Yeah, very important. What's exciting you right now about psychedelics?
I mean, there's so much exciting stuff
Yeah,
about psychedelic medicine. I think there's a lot of, I mean, the most exciting thing. Are you familiar with the results from like the MDMA therapy trials or anything like that?
a little bit, but please.
Well, so I think what to me, there's a lot of exciting stuff, but the most exciting thing is seeing the differences between the results from the psychedelic-assisted therapy studies, like the larger studies, like the MDMA-assisted therapy studies that MAPS has been conducting, which just finished phase 3 trials with the FDA and will, most likely be approved by the FDA for use by clinicians for PTSD in 2024. So this year,
Whoa.
which is really exciting.
Yeah.
Uh, yeah, and the results from the studies are just absolutely astounding. They're like nothing like we've ever seen in the history of psychiatry has been this effective. And those results, like from the phase 2 trial, which is a 100-person trial conducted several years ago, they showed that 55% of people with on average 17.6 years of treatment-resistant post-traumatic stress disorder were no longer meeting criteria for post-traumatic stress disorder 2 months after the treatment was complete. So after 3 doses of MDMA and 42 hours of psychotherapy over 12 weeks, 55% of those people who had never responded to any other therapy successfully were now no longer meeting diagnostic criteria for PTSD.
55% is a huge number.
It's a huge number, but wait till you
Huge.
hear this, what the 1-year follow-up data. So a year after treatment ended, no additional treatment was provided, and they redid the surveys of health and the symptom evaluation, and they found that number at 2 months out went up from 55% to 67% without any additional treatment. And that never happens with any of our treatments, because all of our treatments, going back to what we were talking about a little bit before, are focused on symptom management and stabilization, not getting to the root of the problem. And the whole way that MDMA assisted therapy works is it helps you feel, the medicine amplifies the safety cascades in our brains to feel safe enough to reappraise the meaning of past trauma, so that we are able to understand that it doesn't mean anything about us. It's not personal. And that then we can heal from it when we separate it from ourselves and separate that meaning that was usually caused by the combination of the event and the lack of the support thereafter. So that is how MDMA works. And so it seems like it's actually teaching people how to heal themselves, because they're getting more better 1 year after treatment than they were 2 months after treatment. And there's, again, like we've never seen anything like it in the history of our field.
Yeah, I was listening to I can't remember his name, another guy who's doing psychedelic research in the same sort of vein as you, and he used the word cure mental illness, and I've never ever heard someone use that word in terms of a mental illness. And for me, like I got fired up. I got a little teary-eyed too, obviously thinking about, what I thought about. And so that in alone is like just the fact that like doctors who have studied this stuff for years, like yourself, can use that word and honestly say that with some vigor and some meaning behind it is crazy to me, and something that I'm glad like a lot of people are taking very, very, very seriously. So it's awesome.
Yeah, it's really exciting. And I think that there's just we can't quite use the cure word yet for mental illness. I think if you think about this from what we were talking about earlier, where we're in 1890s, where the famous doctor who just invented hand washing was institutionalized, right? And then it wasn't until 1909 that antibiotics were discovered,
Oh,
right? So that's 19 years until germ theory was discovered, where infections that killed most people Most people died of infections back then. And infections went from something that was a terminal, incurable illness in many cases to curable in almost all cases with the invention of antibiotics in 1909 and the discovery of germ theory. Right? Changed the entire game.
Yeah.
For humanity around the world. It's considered to be one of the greatest discoveries of all time. Right? So what I would say is we are at that place right now where psychedelics were just like illegal and banned, and there's all this like negative propaganda rhetoric about them, and they're still DEA Schedule 1 drugs, so they're not even like rescheduled yet. We're still kind of in the dark ages of mental health, so maybe we're like 1890s, right? Yeah. But soon, or maybe we're in like 1900, but soon, I would say within the next 10 years or so, we're seeing that based on the way that technology is able to help us heal and recover, and psychedelic-assisted therapy is able to help us heal and recover, and what those things are teaching us about healing in combination with medicine is that that we may actually be able to develop what is the equivalent of like an antibiotic for mental illness in 10 years, which would be a cure for mental illness. And it's not going to be a pill that you just take every day for 5 days and your mental illness is gone. It's going to be, a prescription for 3 doses of MDMA and 42 hours of psychotherapy with 2 therapists over 12 weeks. And that's going to get you to 80% likelihood of getting better, just like an antibiotic, right? Or 90% likelihood of getting better. And we're going to have that kind of knowledge and that kind of ability to actually not just treat mental illness forever, but actually cure it. And, nothing could be more exciting than that. For a psychiatrist.
Yeah. I can't wait to go back to this episode 10 years from now, clip it and post it on whatever social media platform exists in 10 years and be like, yes, we talked about it here. That's amazing. But what I like about that is that people still have to do the work, right? Like 42 hours of actually still doing the work, like talking through it, thinking about it, addressing it, processing it. It's not just like, because that's where I think a lot of people get misconstrued when they take these drugs sort of recklessly and aimlessly and without intention and without set and setting. They're like, all right, take this, boom, I'll be good. Everything will be fine. No, there's like still a ton of work. Like if I go and take steroids right now, I'm not going to be any different than I am right now. But if I take steroids and hit the gym 7 days a week, bro, let's go. Like, I still won't be able to play Major League Baseball because I can't hit that pitch, but I'll be stronger, bigger, faster, things like that. And the same with the psychedelic treatment. So I think that piece is important for people to note. Like there's still a ton of work that you have to put in terms of addressing yourself, but there's something else that'll help you with the therapist, the treatment, the psychedelic, all of that stuff goes hand in hand and working together to combine to help you, live more free, more joyous, all of that good stuff.
Yeah, absolutely. And moral of the story is, you got to do the work. The work is there and we got to do it. And we spend a lot of time trying to avoid doing it, but we got to do it. And that's the only way to get to the other side. In therapy, we describe it, imagine if you're on a journey and the only way to get to the next phase of your journey is in and through. You can't just step out of it and try to escape or numb yourself to it, because you're going to come back to whatever that thing is that was trying to get your attention, and it's still going to be there, right? You're still going to have to deal with it. So it's just in and through.
Yeah, absolutely. Just to wrap this conversation up, let's talk about technology, because obviously you founded a company that's a wearable technology. There's Oura Ring, there's Whoop, there are all these things. How I mean, I know you think they obviously played a very important role in the future of our wellness, but like where do you see like it going hand in hand? How do they intermingle, like doing the work along with maybe wearing the ring or wearing your product Apollo? Like how does it all fit together so people aren't just like, if I wear this thing I'll be better, like sort of like the psychedelic thing or whatever the case may be?
Yeah, so I would think about it like there's 3 generations of wearables. Generation 1 is like the first Fitbits and the first step trackers that just gave you data, and they didn't do any analysis to that data. They're just like, here's a bunch of numbers about your life, right? Figure it out. So you have to analyze the data. You have to, in your head or on paper, you have to process it on the computer. You have to look at it and you have to figure out like, what does this actually mean? to me about my life and how do I change behavior from this, but it requires a lot of work. And then the second generation of wearables is where most wearable fitness trackers are today, if not all, which is tracker trainers. So they're collecting data from you. So this is the current Apple Watches, the current Fitbits, Whoop, Oura Ring, and Garmin, and many others that track. There's so many now. It's hard to keep track, but those all track your data. They process the data for you and do the analysis, and then they give you information about what to change, right? They actually tell you what to do based on your data. And so they train you to try to help you change your own behavior, but you still have to take the information they're giving you and put it into action to feel any different, right? You have to make a change in your life. Like you have to go to the gym and do the work to feel different. And that's kind of where we've been up until 4 years ago when we launched Apollo. And Apollo was really created as the first of the third generation of wearable technology, which is wearable that helps do some of the work for you by changing the way your body feels. Because a lot of us are so overwhelmed and stressed out all the time that we don't even have the bandwidth to start doing the work because we feel so crappy. So what we figured out was that by delivering a very gentle, soothing vibration to the body, and for anybody who's listening to this who has an iPhone, you can feel Apollo right now by going to Apollo Neuro in the App Store and opening the app and clicking Feel Apollo on your phone. You'll feel this very smooth, soothing wave of vibration that slowly goes up and down at a very specific rhythm that, when delivered to our body, nudges our breathing rate in our lungs to around 5 to 7 breaths per minute. And that 5 to 7 breaths per minute is our breathing, the rate we're supposed to breathe at, which is starting to get into, calm and meditative breathing at a basic level. That's how we're supposed to be breathing most of the time. And we're actually breathing at 12 to 18 breaths per minute most of the time, which is stress breathing. So stress breathing means we're going to have higher heart rate and higher blood pressure, and we're going to have faster thoughts. And our breath really does control a lot of these different functions in our bodies. So Apollo is actually, changing our breathing rhythm by sending these soothing vibrations to the body, anywhere on the body. Like I'm wearing it on my chest right now, that my body interprets as soothing touch. And so vagal nerve tone goes up, and your breath rate slows, and your heart rate slows, and your blood pressure comes down a little bit, and your shoulders relax, and your face relaxes, and you just start to feel more present in your body, as if you had been practicing meditation, because you're embodied, you're in your body, not up here doing this thing that we do all the time, right? So that was developed out of my research at the University of Pittsburgh in the Department of Psychiatry for that specific purpose, originally for veterans with severe PTSD. And it was an incredibly revolutionary discovery because it was not known at that time. This was back in like 2016, 2017. It was not known that you could send a vibration rhythm to the body. Apollo is just sending sound waves to the body. You could send sound waves to the body that you can feel through your skin, but not hear through your ears, that can change your heart rate and your breath rate and your ability to perform under stress and recover from stress. That was not known. And that's what we showed in our research from the university, which is wild. And so this became the first non-electrical way to modulate the nervous system. And why is that interesting in particular in the context of Oura Ring and Apple Watch is because they measure the parts of the body that we're changing. Right. So Apollo improves heart rate variability. It's the only wearable technology that has ever been found to just improve heart rate variability by wearing it. Just by wearing it, you don't have to do anything. And that is because it calms the body and increases vagal tone. And so you can track that on your Oura Ring and your Apple Watch. And so we just through doing much research over the last several years in collaboration with Oura, we just formed a partnership with Oura, where now we take your data from Oura Ring, and we use generative AI to customize a schedule of Apollo vibes for your day so that we can understand where your HRV is when you wake up, and your sleep, how your sleep was last night, and how ready you are for the day. And we can then customize vibes to get you more ready for the day and to help you be more alert and more focused and more clear when you need to be, and then also help you wind down and go to sleep more soundly at night without having to drink alcohol or take a sleeping aid or something like that. So we're actually able to put the data from other wearable trackers now to use. And that just launched in November, which is a really fun AI product that's actually helping people feel good, and there's a lot of uses of AI we don't talk about enough, and healing is actually one of them.
Right. Yeah. Personal anecdote about the Apollo. I was wearing it out one night. I was with some friends. We were going to a couple bars, and they saw it on my wrist, and I was telling them about it. And then one of my friends was feeling like a little anxious. There was like a lot of people coming in, so she was like feeling pretty crowded or whatever. And so I was like, hey, put this on, go to this setting, I'll tap it on my phone. And I kid you not, man, like a few minutes later, she was like, okay, I feel a little better. Like we can stay. Like I know there's a lot of people like, and she was just like, it was cool the rest of the time. And based on just like getting her to just like settle down a little bit, like I could have told her to take a few deep breaths and all that stuff that probably would have worked. It might have taken a little bit longer, but it's hard to do in a crowded room in a bar when everyone's drinking. Like that's a lot going on. But she put a thing on her wrist, like boom, a couple minutes later, she felt good. And so that's a personal anecdote that I wanted to share. So thank you guys for sending me that. It's quite a cool product.
Oh, thank you. I'm so glad that helped her. Did you use a social vibe?
I did.
That's my favorite.
And then it's funny. And then she when she started feeling good, she was like testing the percentage. Oh, this feels. Oh, ooh, ooh. So then she just started having a good time. And then she was asking me what it was, and I sent her some of the stuff about it. And then so it was like pretty cool. Worked great. So awesome.
That's awesome. Yes, that kind of social anxiety is actually like when you start to get overwhelmed in a crowded place. That's one of the things that it works for like almost immediately.
Oh yeah.
And I used it for public speaking when I first started having to present a lot on this work. I used it for my public speaking anxiety, and it really helped. I would say within 3 to 6 months, I didn't even need it anymore. Like I was just good because I realized that I didn't need to be. I had the mindful moment on stage one day that was just one of those like light bulbs went off, that I realized that I did not need to be spending time thinking about what other people were thinking about me while I'm talking.
Mm-hmm.
Because every ounce of my attention that I spend thinking about what other people might be thinking about me while I'm presenting is taking attention away from presenting what I'm supposed to be presenting.
Yeah.
And so then I do a worse job. So if I just, just in rational way, if I just said, hey, I am in charge of these resources. Like I'm just going to take all my attention and move it over here to the presentation, and I'm not going to think about anything else. Then it taught me over time how to use my brain better. And that was so cool.
Yeah, that's wicked. Yeah, it's you were on Dr. Michael Gervais' show. It's his big FOPO idea, fear of other people's opinions. Also, great book that he came out with. Anyways, but yeah, it's amazing. So, yeah, he's wonderful. I've listened to. I feel like I know him. I've listened to him so much. But where should people go if they want more of you, Dr. Dave?
You can find me on socials. I'd love to hear from you. I'm at Dr. David Rabin on Instagram and at Dr. David Rabin on Twitter, X, and my personal website and clinic website is drdave.io. And if you want to hear more about my work with consciousness and psychedelics, check out the Psychedelic Report, which is your single source of truth for the psychedelic news on Spotify and iTunes, Apple Music. And you can also check out Your Brain Explained, which is a quarterly show on consciousness on Spotify and Apple Music.
Sweet. Everything will be linked in the show notes below, but thank you, Dave. Awesome conversation. Appreciate the work you're doing, and I look forward to checking it out more.
My pleasure. Thanks for having me.
If you enjoyed that episode, please click here for another full-length episode of the podcast. And please don't forget to subscribe. But above all else, most importantly, please take good care of yourselves and others. And I'll see you next time. Lots of love. Cheers.